From the Einstein Healthcare Network studios in Philadelphia, this is Health and Wellness.
Hello everyone, I'm Genaye Channel with my co-host, Dr. Jack Kelly, Interim Chairman for the Department of Emergency Medicine at Einstein Healthcare Network. This is the ER Show. Today, we are defining emergency services and trauma care. Dr. Kelly, let's get right to the questions from our viewers. So, what is the specialty of emergency medicine?
Emergency medicine began as a specialty about 40 years ago. It was the way physicians who would work in an emergency room began to develop all of the skills of managing multiple different kinds of emergencies.
So take us to the ER, if you will. I know you spend a lot of time there. Tell us what really happens in there and how you distinguish the nature of the emergency for the patient.
Sure, so it's all about triage. And triage is a French word meaning to sort out. When you walk in, there's a triage nurse who would quickly look at what your concerns are, maybe do a quick interview and quick vital signs, and then begin to prioritize whether you'd be a level 1 or a level 5. Level 1 meaning high priority, 5 meaning low priority. So we have to prioritize all of our resources, all of our assets, all of our space, and we have to treat the sickest people first. And so that's the way triage happens. We also are triaging some of the ambulances that are coming in to see whether or not they have a life or death emergency or something that could be taken care of in a lesser place, in an area of the ER where we have more room and more space, and also more time.
So what is the difference between emergency medicine and trauma medicine?
Emergency medicine is more of an overarching strategy that would involve all different kinds of emergencies, not just injury. So trauma care, and as we manage trauma patients, is actually reflecting upon the injuries or multi-system injuries that somebody may sustain. Yet the emergency physician is looking above all of that to look for medical emergencies, surgical emergencies, all the other domains that are part of emergency medicine.
So let's just say I was admitted to the ER. Who else would I see that day?
Well, you certainly are going to see all of the ER team, which is our nurses, our docs, our PAs, our techs, as well as the X-ray techs, CT scan techs, and ultrasound techs. But then we would probably call in a consultant sometimes if you have a specialty issue that we would like to link you up to a specialist right away, or admit you to the hospital. We would admit you to the service that would be taking care of you in the hospital. So we would call that specialty down. We would introduce you to them, and they would get to know you too. And then with a handoff, they would begin to take care of you as an inpatient.
Interesting. So tell us about the training for an emergency physician. You go to med school, 8+ years, you do your residency. So where does it click? What is the training like?
Well, the training in emergency medicine is very different than most other specialty trainings because we have to spend time with all the other specialties to be able to learn their trade, learn a lot of the secrets of the presenting concerns that somebody with that specialty emergency may have, and then what emergency therapy should be started right away. Our role is immediate recognition, and then immediate stabilization, and immediate treatment, and then calling in the other experts within that specific specialty to be able to harmonize what will be needed, and then to be able to hand them off for admission.
Dr. Kelly, thank you so much for your time as well as this great information. Be sure to watch more episodes on this topic and other issues of interest to all patients here on the ER Show. We will see you next time.